TV5 News at 9, and it's time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Matt Dybel. Thank you so much for being here. We love it when you're here, Doctor, because we always get great information from you. How are you?
I'm doing great.
Great, awesome. Thank you so much for being here. Well, today we are talking all about how people can help busy hospitals. Doctor, you're a medical provider in the Covenant Emergency Care Center. Can you tell us what trends that you've been seeing in the last few weeks?
Well, we've definitely been seeing an increase in patients, and not just any patients, but we've been seeing an increase in sicker patients, patients that end up staying hospitalized for kind of longer than average right now.
Now, Doctor, what's really causing this issue with overcrowded hospitals? Is it purely just the COVID-related patients?
Well, COVID is certainly a piece of this.
Yeah.
As you probably recall, we've had about 4 different peaks of COVID. This one right now, at least for us in this region, is the second highest one.
Wow.
But it's still only about half the size as it was last year. So not only do we have COVID, but we also have a lot of just regular patient care, people who have had heart attacks or strokes or other medical conditions, cancer, other things that need to be taken care of urgently also.
Now, Doctor, healthcare systems across the state have really been seeing similar trends like yourself. And they've been really busy caring for patients. How can the community lend a helping hand and help healthcare providers?
Well, right now, as things have been so busy, I guess there's a few things I would say for the community.
Yeah.
One is be patient, and 2 is be grateful. Be patient because right now, in general with healthcare, there is a lot more need than there is that we can have capacity moving through easily, and so waits are going to be longer than normal. And so be patient with that. And second, be grateful. I worked over the Thanksgiving holiday, and I had 2 patients in particular that thanked me just for being there and working. And that meant a lot to me. And I think us taking those opportunities to thank people for being there for them really makes a difference.
I think those are great messages that we all need to do. Be thankful, be grateful, and have patience. Pack a lot of patience. Doctor, now if someone has a medical need, what should they do?
Well, if you feel like you need medical care, really there's a kind of a stepwise process you always want to take. Number 1 is always going to be your primary care doctor. And so ideally you'll follow up with your doctor, and if you have any questions, you'll talk with your doctor. Now, if it's a time that your doctor's not available, but you still need to be able to be seen pretty quickly, but it's not for something too severe, then MedExpress is a great option for you. If, however, you have something much more serious, so you have heart attack symptoms or stroke symptoms or a serious injury, then the emergency department is the place you need to be. And we're of course, always open for people to take care of those emergencies.
That's great. Great tips there. Doctor, what should people do right now to stop the spread of illnesses, especially in the upcoming months?
Well, it's the same story that we've all heard over and over again. Get vaccinated.
Yes.
If you've been vaccinated, get a booster. This is the biggest difference it's going to make with COVID. And not just COVID, but let's make sure you get your flu shot this year, too. We are starting to see very, very few cases of flu, but we know in the years past that there has been a pretty significant impact on people's wellness in the winter. So making sure you're vaccinated for both COVID and for flu. And then right now, the recommendation in the state, and I agree with this, is mask if you're indoors with lots of people as much as possible. We have a lot of illness in the community right now throughout the nation, and we want to minimize that spread.
I love it. I did a double whammy. I did my flu vaccine as well as my COVID booster at the same time. Easy breezy. I did my kids. They're vaccinated as well. Anything, Doctor, anything else that we need to be aware of right now, or a message that you would have for viewers?
Just want to thank the community for their support in general. It's been a tough couple of years,
yes.
Almost couple of years now, and appreciate the support from the community. Also, just a reminder that looking at COVID in particular, this is not just an illness of people who are elderly or have high risk factors. A lot of those people have been vaccinated. We've unfortunately seen young, healthy people who've gotten very, very sick and sometimes even died from COVID. And so please take this seriously. Continue to minimize the spread. Make sure you get vaccinated. Encourage your loved ones to get vaccinated to protect yourself and to protect your loved ones.
Thank you for calling in with this valuable information. We appreciate you, Doctor. Thank you for all that you do in the community.
Thank you so much.
You're welcome. If you'd like any more additional information about today's topic, just head on over to the Hot Links page at WNEM.com.